Imagine you're holding a dying bird. It's a swift, a wild creature so specialized it spends almost its entire life in the air. It arrives severely dehydrated, unable to eat its natural diet of whole insects. Out of desperation, you feed it an experimental, processed nutritional gel. Within just a few days, the bird visibly recovers, puts on weight, and launches from your hands back into the open sky. You just watched an animal go from the brink of death to taking flight. The natural, completely understandable human reaction is to declare this experimental product a definitive, unquestionable success. You might even write online, "We've saved so many birds with this, it works." But in the professional world of wildlife rehabilitation, that exact phrase triggers serious alarm bells. Leading biologists and veteran rehabilitators are raising major red flags about this very scenario. The scientific method treats a personal observation as the starting point of an investigation, not the final verdict. Seeing a recovery is simply the spark for a hypothesis. It is not the evidence that proves it. Stabilizing a starving animal in a clinical setting is a significant hurdle, but basic survival remains the absolute lowest bar for biological success. To understand why, we have to look at how our own brains are hardwired to misinterpret what we see right in front of us. The first cognitive trap we fall into is relying on anecdotal evidence. A handful of isolated clinical successes feels like a pattern, creating a false sense of security that blinds us to historical precedent. Wildlife rehabilitation has a long history of adopting alternative diets decades ago, formulas based on rat meat, cheap dry dog kibble, and mixtures of egg and cheese. At the time, professionals were absolutely convinced these formulas worked and even published favorable articles. Years later, the data revealed a much darker reality. Many of these alternative diets were causing severe, initially invisible damage to the bird's structural growth, plumage quality, and long-term physiological health. Insectivore digestive systems have adapted over millions of years to perfectly match the biochemical structure of whole arthropods. When you mash processed ingredients into a generic paste, you lose that complexity. You cannot hack evolution by swapping the prey's physical form. Two diets might share a general origin, like animal protein, but sharing basic nutrients does not equal physiological equivalence. A raptor and a cat both eat meat, but no professional would feed a hawk an exclusive diet of cat kibble. When these processed diets are questioned, the most common defense is immediate and emotional. Without this gel, the bird would have died. Testing a new diet against a baseline of starvation tells you absolutely nothing about its actual nutritional value. You are comparing the product to zero. This illustrates two very different medical scenarios. On the left, you have emergency triage, where keeping a critically dehydrated patient alive is the only goal. On the right, you have a long-term, exclusive diet required to build a physiologically competent animal capable of hunting and migrating. What keeps a critically ill patient alive in an emergency scenario cannot automatically be extrapolated as a safe, exclusive diet for their entire development. This brings us to a methodological flaw that plagues almost all clinical observation: survivor bias. Our brains inherently focus on the victories. We vividly remember the few individuals that successfully recovered on a new treatment and were released back into the wild. We zero in on highly visible successes, completely overlooking the silent failures, birds with sudden weight loss or degraded feathers. Without tracking every outcome, negative results fade from memory. The antidote is rigorous data collection, actively comparing a test group against a natural diet control group. Until we have that comparative data, clinical impressions will continue to lead us toward erroneous conclusions. Rigorous data collection is the only tool we have to pierce through the illusions created by our own cognitive traps. Which leaves us with a stark paradox in how we treat the animals in our care. Think about our domestic pets. If a company invented a brand new dog or cat food, no one would accept its use as an exclusive diet without years of peer-reviewed clinical trials proving its safety and nutritional adequacy. Yet when it comes to wildlife, specifically highly specialized wild species, we frequently drop that standard. We allow anecdotal evidence and clinical impressions to be deemed good enough. The reasons for this gap are completely understandable. Wildlife rehabilitation is chronically underfunded. Centers are overwhelmed by a high volume of patients, and much of the critical daily care falls onto the shoulders of external, hard-working volunteers. Despite these persistent constraints, a swift's biology doesn't bend to our convenience. Precisely because of their profound biological complexity, wild species actually require a higher level of scientific rigor before we permanently modify their natural nutrition. Asking for data is not an attack on well-meaning volunteers. It is not an attempt to demonize a new product. Demanding rigorous comparative testing is the ultimate expression of care for the animals we are trying to save. The scientific method exists entirely because human observation is inherently flawed. Science does not advance by replacing questions with convictions. It advances by subjecting our convictions to evidence.